Getting ready for the meds round. The equipment you'll need will depend on what you are administering, such as tablets, liquids, creams, but also the person's preference. Oral medicines may need medicine spoons, cups, or oral syringes. To clean any equipment, we need to ensure we're washing them in warm, soapy water and leaving all items to air dry. We never dry them with a paper towel or a towel. With syringes, there is often confusion about how often we should change them or how long we should keep them for. As per NICE recommendations, syringes for oral medication can be used until the markings start to fade. To wash an oral syringe, we need to draw some water in and out of the syringe a few times. Items for the medication round should never be washed in a dishwasher or sterilizer. Next, check the medication documents. As well as medicines charts or MAR charts, there may be other medicines documents to refer to, such as administration profiles, body maps for creams and transdermal patches, and also when required protocols. It's important when administering medication that we check the individual's identity. If you don't know the person, ask their name, check the photographs contained on the MAR chart, or ask another member of staff for information. Next, we must always start with the chart. The Medicines Administration Record, more commonly known as the MAR chart, lists and records the medicines a person takes or uses. The exact way you work with the medicines chart will depend on the format of the chart you use, whether it's paper or electronic, and also the individual design. It may sound obvious to check the MAR chart first. However, once you've administered medicines to the same person a few times, there is temptation to not start with the chart, as you will quickly learn what medicines they have. This is where mistakes happen. Doses and directions may change, medicines might have been stopped, or new medicines added and prescribed. Hence, we make the following checks. We check to see how many charts there are. We then check to see which medicines are due at that time. We then check to see if any medicines need to be given with or without food. We also check to see if the dose has already been given or taken. We then check to see if the last dose was recorded correctly and that sufficient time has passed before we administer the medication again. We need to remember to carry out the 7-point check prior to administering medicines. Number 1, check the client's name. Number 2, check the name of the medicine. Number 3, check the strength of the medicine. Number 4, check the form of the medicine. Number 5, check the directions. This could be take one daily. Step 6, check the medicines inside. Step 7, check the expiry date. Prior to each medication round, ensure you wash your hands thoroughly under warm running water with soap and dry your hands with either a hand dryer or a paper towel. As normal, staff members administering medication should be bare below the elbow, meaning short sleeves, no wristwatches, and a plain wedding band is acceptable. Staff members should never have nail varnish or false nails. Prior to each medication round, the trolley needs to be clean. We can clean our medication trolleys using either surface disinfectant wipes or antibacterial spray and a correct colour-coded cloth. Following each medication round, the trolley needs to be wiped down. Once the trolley is clean, we must prepare it with the appropriate equipment. Sufficient amount of water, cups or beakers, disposable medication pots, syringes, giving spoons, and antibac hand gel. Designated individuals will have the key to the medication trolleys. The medication trolley should never be left unlocked and unattended at any time. The administration of eye drops. There are many different ways of administering eye drops. The important thing is to get the drop into the person's eye in a way that doesn't cause them any discomfort. Some people will sit patiently and let you administer eye drops. These are usually people who have had eye drops before. The step-by-step process to administering eye drops is as follows. Step 1. Get ready. Check the drops haven't passed their expiry date, and when breaking the seal on the new drops, the expiry date must be written on the bottle and the boxed packaging. Eye drops usually last for 28 days. Step 2. Prepare the individual. The person can be sat upright in a chair. They do not necessarily need to tip their head back with the following technique. Step 3. Prepare the right dose of medication. Shake the bottle, unscrew the lid and put it somewhere clean. Gloves are only needed if the person has secretions from an eye infection. Please note that secretions do not mean tears, as tears would always be present. It's infected tears only. Step 4. Administer the medication. Push out a drop and leave it hanging from the tip of the dropper bottle. This is known as a hanging drop. With your free hand, pull the lower lid gently away from the eyeball to make a pocket in which you can place the drop. Tell the person to look away, towards the bridge of their nose if possible, and then upwards. Looking up takes the upper eyelid and lashes out of the way and gives you more room to administer the drop. Gently touch the drop onto the lower lid to release it. Don't worry if you accidentally put more than one drop in the eye. The eye can only hold on to one drop, so any other drops will flow away harmlessly down the cheek. It's advised you give the person a clean tissue to wipe away any excess drops. Once you've put the drops in, tell the person to close their eyes for around 30 seconds. This spreads the drops over the eyeball. We should then be checking for any redness, pain, itching or swelling in the eye. A little stinging and itching is okay, as long as it's not too uncomfortable for the individual.